A C8 suite to err is human-human factors in the healthcare systems. Joey.
Imagine this. It is midnight. You're a doctor in the emergency room, and you have been working non-stop for the past 30 hours. Now, a patient was sent into the hospital because of a serious car accident, so you can rush into the patient, set up the ventilator, a machine that will help him breathe, and started to perform CPR as soon as possible. But 6 minutes later, the patient died. What could possibly be the reason? Howard?
The doctor was too late.
The doctor was too late. Quite right. Actually, the reason of his death was because you forgot to plug the ventilator. You forgot to plug. How could it be possible? I mean, why is it happening? It's ridiculous, but unfortunately, it's also a true story. So why did these kind of errors happen in the first place? I mean, even we, all of us, know we have to plug a machine for it to work, right? So it's not about medical knowledge at all. It's about the hazardous circumstances and working environment that led to this medical error. As a doctor, also as a mortal human being, to err is inevitable. Fortunately, we have human factors here to help us make things right. So today, I'm going to share with you some examples of how human factors work in our healthcare system and why it is so important to all of us. So first thing first, I think we should start with what exactly are human factors. So simply put, this is how we interact with a machine in our daily life. So you don't have to look at the complicated form, just listen to me. So the blue part is how a machine works, and the yellow part above is how we process information and make decisions. Now, human factors focus on the green part in between, which is the interface that serves as a bridge between the machine and its user. Human factors went into full bloom in World War I. And that was a time when a mistake made by a pilot of a bomber could cost millions of lives. So they designed the seat, the panel in their aircraft according to human factors to help the pilots keep their attention focused and prevent possible mistakes. And the same thing can be applied to the hospital too. To tell you the fact, the hospital is no safer place than a battlefield, with people dying every day because of medical errors. According to a study in the USA, at least 44,000 people, and perhaps as many as 98,000 people, die in the hospital each year because of medical error. And that is the 5th leading cause of death in the United States. Let's see about what's the condition like in Taiwan. Well, to tell you the truth, it's even worse. Mainly, we have 3 major hazards in our hospital. First is long working hours. Second is taking on excessive night shifts. And last is having too many patients to care for. So these factors make Taiwanese doctors exhausted and therefore also endanger patients' safety. In 2014, Taiwanese doctors worked 81 hours per week. Wow, even the most tiring doctor in the USA work only 65 hours per week in comparison. And from another study, we can know that a single night of sleep deprivation, in other words, taking extended night shifts, can cause doctors' performance similar to those who have a blood alcohol level of 0.1, which is quite close to that of a drunken driver. So no wonder Taiwanese doctors tend to make medical errors, because they're perhaps either exhausted or somewhat drunk. So how do we ensure the doctors to do the right thing under such hazardous circumstances? Well, here is where human factors comes to the rescue. It helps us prevent possible medical errors by designing the operational interface according to humans' natural instincts and habits. Let us look at some examples. So first is a good example of how human factors can be incorporated into our healthcare system. Now, who can tell me what this is? Well, it's a defibrillator. 去颤器. I think you probably all seen it in a movie, right? It works like this. Yes, just like this. Now, if today I'm an exhausted physician, exhausted doctor, and I come to the front of the defibrillator, wow, it's a little bit complicated, right? And I'm so tired. But I can simply follow the SOP. As you can see, there are numbers beside the buttons needed to be pressed. So first, I switch on the power. Second, I press the analyze button to see if the patient is suitable for defibrillation. And third, I press the shock button. So it's as simple as this. 3 easy steps. With this user-friendly interface, I can avoid errors like forgetting to switch on the switch, even if I'm really tired. Now here comes the second example. It's an inappropriate example in regard to design. Here are 2 very identical tube connectors that may easily lead to misconnection and medical errors. So say today, if I want to give the patient some oxygen, O2. Now because the tube connectors look exactly the same to me, so I might misconnect them. So instead, the patient got what? Carbon dioxide, CO2. Wow, that would be a disaster, wouldn't it? So how do I fix this? Well, the solution is really simple. I designed tubes of connectors in different colors and different types, so the tube connectors don't look the same anymore. It seems really simple, right? Problem solved. So, to wrap it up, human factors should be an essential consideration when we're trying to design our healthcare system. It is a very important key to help us secure our health under such hazardous circumstances. And also, it is very simple. Just put some numbers beside the buttons needed to be pressed, or simply changing the color of the tube can make our medical system a safer place. So next time, all we have to do is to try to observe a little more closely, pay a little more attention to the common medical errors in our healthcare system, and maybe use our creation to find a solution in regard to human factors. Then we'll be able to make our healthcare system a safer and a better place tomorrow. TME.